Hello, this is Dr. Sushma. Welcome back to my channel Dental Notes and Mnemonics. Today we'll be discussing about an important topic for denture users, which is denture stomatitis. So let's explore what it is, how it happens, and what you can do about it. It starts with the definition first. Denture stomatitis is an inflammatory condition affecting the mucous membrane beneath a denture in patients who wear dentures. It is characterized by redness, swelling, and discomfort in the area where the denture comes in the contact with the oral mucous membranes. It is a recurring mucosal condition, and the other terms which are used to define this condition is chronic atrophic candidiasis, chronic denture palatitis, and denture sore mouth. Incidence of occurrence of denture stomatitis is as high as 70% of the people who are wearing dentures, and this is having higher prevalence in women. Most of the affected patients with denture stomatitis are usually asymptomatic, and condition mostly occurs in the palatine mucosa, as we have already discussed. Now let's talk about the etiology of denture stomatitis. Many factors are there which may affect the development of denture stomatitis, and predominant factors is the overgrowth of Candida species, particularly Candida albicans, and this condition is often increased by the poor oral hygiene of the patient or the dental hygiene of the patient, continuous dental wear, or the ill-fitting dentures. The factors which are contributing to the development of denture stomatitis so include mainly the poor dental hygiene, continuous dental wear, because when the patient wears the denture continuously without removal, it can lead to an environment where the Candida can thrive. Ill-fitting dentures or the dentures which do not fit properly can create an area of trauma and chronic irritation, contributing to inflammation and the candidal infection. Apart from these, the underlying health conditions like diabetes, immunosuppressants, and salivary gland dysfunction, which may lead to dry mouth or the xerostomia, can also lead to the denture stomatitis. As when there is a salivary flow is low, it can facilitate the growth of Candida and can increase the condition also. So now we'll discuss that how the denture stomatitis will appear in the clinical settings. It will be having different symptoms ranging from completely asymptomatic to pain and irritation, and in those cases where the Candida overgrowth is so intense, the patient can complain of discomfort, alteration of taste, dysphagia, and a scalding sensation in the mouth. According to clinical aspect of the lesion, Newtonen in 1962 clinically graded denture stomatitis into 3 progressive stages. Type 1 denture stomatitis is known as the punctiform hyperemia as well. The patient presents with a pinpoint hyperemic points or areas that are localized, and the chief etiological factor is being trauma in this case. Type 2 denture stomatitis appears as diffuse erythematous area, and these areas are generalized. Most widely seen presentation, and it usually extends over a part or a complete denture bearing area. 3 is the granular hyperemia variety, where the mucosa is hyperemic and it appears nodular, which mostly involves the central part of the palate and the alveolar ridges. Diagnosis of denture stomatitis can be made primarily on the basis of clinical presentation. The examination will reveal red, inflamed mucosa under the denture. Patient history should also be taken because it will give information about the dental hygiene practices, duration of denture wear, and any other associated symptoms. In some cases, we have to go for the swabs or the scrapings should be taken for the culture to identify Candida species and confirm the diagnosis. The management of denture stomatitis involves targeting the chief etiological factor involved, which may require one or a combination of the treatment modalities, which we will be discussing later on in coming slides. First of all, start with the fitting of the denture. because faulty design often lead to trauma, which may lead to denture stomatitis. So we should trim, smooth the overextended or the roughened areas on the denture fitting surfaces. And to improve the overall retention of the complete denture and decrease the mucosal pain, we can use a tissue conditioner such as viscogel or GC tissue conditioners. And nowadays the antifungal drugs have been also added to these soft liners. Plaque control is very important. The denture hygiene methods can be divided into the two types. The first one is an active methods, and those second one are the passive methods. In the active methods, we use the mechanical brush and to clean the denture using non-abrasive denture paste. It helps to remove the food debris and prevent the dental plaque. On the passive method, we use or disinfect the denture using the various disinfecting solutions or by the microwave irradiation. Mostly the soaking dentures, the 2% of the chlorhexidine solution or the 0.1% of the hypochlorite solution or white vinegar in the dilution of 1:20 is used, and denture should be soaked in the solution from 15 to 30 minutes twice on weekly basis. Antifungals are also prescribed, which directly addresses the pathogenesis of denture stomatitis and ensure complete resolution of the condition when combined with the proper dental care and hygiene practices. But antifungal may be given topical form or in the systemic form. Dynamic therapy is an innovative treatment for denture stomatitis, which can be used as an alternative to antifungal treatment. It targets a harmful fungi and bacteria under the dentures. There is a photosensitizer which is applied on the infected tissue, and which is exposed to the light, it produces reactive oxygen species that destroys the pathogens. Managing the underlying systemic diseases is utmost important in order to prevent the reoccurrence of the infection. This includes the advice to the patient to quit smoking for the smokers, nutritional recommendation especially regarding the carbohydrate intake for the denture patient with high sugar consumption, since glucose enhances candidal growth and adherence to denture surface. Moreover, few patients may benefit from the prescription of salivary substitutes to treat the xerostomia. Some of the recent developments in order to avoid the reoccurrence of denture stomatitis are as follows. The use of protective coatings on the denture surface to decrease the candidal adhesion, incorporation of antibodies specific to candidal species into prosthetic material, and use of antifungals in the denture material. Regular dental checkups, patient education, educating the patient of the proper dental hygiene and care can significantly reduce the incidence of denture stomatitis. Along with all this, the monitoring and the adjustments on the regular basis and the maintenance of dentures is very essential for preventing complications. If we talk about prognosis of candidal infection, denture stomatitis, then it is generally favorable. Reoccurrence may occur if contributing factors are. If we talk about the prognosis of denture stomatitis, then generally it is good. It is favorable. But the reoccurrence may occur if the contributing factors are not addressed well. The patient should go for the regular follow-up with the dental professional. It is very important to manage and prevent the reoccurrence effectively. So this was all about denture stomatitis. Hope you like my video. Thanks for watching. And if you found this video helpful, please like, subscribe and share for more videos like this, and hit the bell icon also. So next time whenever I will post a video, you will get a notification. So see you soon. Till then, bye bye. Take care.